Hey Leo, did you know you could use delta ratio to treat your patients better?
No one can.
Yes, you can. And if you use it, you might sound so smart in that ward round that your consultant might actually remember your name, even though you've worked with him for the past 4 months.
Stop, come on. We should walk away from this.
Oi, any SHO, shut up. I know you gave that vomiting patient 5 liters of sodium chloride, which is why I'm having this conversation with Leo in the first place. Hey Leo, come here. If your patient has a high NR-gap metabolic acidosis, you can calculate the delta ratio by taking the patient's NR-gap in millimoles per liter, subtracting it by 12, and then dividing that by 24 minus the patient's bicarbonate. And Leo, if the delta ratio is less than 0.8, that means the patient has got a high NR-gap metabolic acidosis and a concurrent normal NR-gap metabolic acidosis. If it's between 1 and 2, that means you only have a high NR-gap metabolic acidosis. But if it's more than 2, that means you got a high NR-gap metabolic acidosis combined with a metabolic alkalosis. An easy way to remember is just remember 1 and 2 as a ballpark figure.
If I were to do this, if I even could do it, I'd need a guarantee.
There's no guarantees in medicine. I can guarantee your consultant won't know what you're talking about, but will still think that you're clever. Just as I guarantee that there was enough space on that plank after the Titanic sank for both you and Rose. Rose did you dirty.